Good afternoon, everybody. My name's Scott McGann with the Falmouth Health Department, doing a COVID-19 update for March 10th, 2023. We've averaging, it was 40 confirmed PCR cases during the last 14-day period, bringing the case count to 6,327. Again, this is PCR, so we actually don't know for about past, since January of 22-ish, what the actual case counts. Most people use home kits. They're not going to show up on this. But if PCRs go up, you would reasonably to assume that they so aren't the home kits. And so when PCR goes up and down, so is the total number of cases. We just don't have an accurate number of what the total number of cases are because we won't know what the home tests are. So we've been averaging about 19 over the last 4 weeks, which is a lot better than, let's say late December, early January. So very, very similar to the week before. Our 14-day incidence rate's down 3.7 to 7.9, and our positivity is down to 6.92. Again, all this is based on PCR. When PCR goes up, then COVID's is up. So that's just the way to look at it. The numbers aren't really all that important. They're not really relevant per se, since we've got home tests to give you an accurate case count. But that being said, again, it's been pretty good. It's on a decline. We remain, all these numbers are almost the same. So this is the CDC update on guidance. We're either low, medium, or high. We're low as we were last time I did this a couple weeks ago. Numbers are almost exactly the same, within a couple. So one was up a slight, down a slight. So very stable right now with COVID over the last 4 weeks, which is good. And if you look at hospitalizations, this is hospitalizations in Barnstable County. Again, around that January 1st of 23, we had an uptick and then a down. Nothing like the 2 previous Januaries. And so we're on that sort of low, similar to what we were in the summer, kind of where we are with roughly like the summer of 22, as far as hospitalizations, similar. So, that's a good sign. And the weather's getting warmer. We're going to be outside more, so that should hopefully stay that trend. Same thing in the state. These are the state trends are all on the downward, low to downward, so that's good. Again, as far as their peers, we're a little on the higher side, but again, all these numbers, this is incidence rates, number of cases, daily cases if the population was 100,000, so all the populations are adjusted to 100,000. We're at 7.9, slightly higher than the rest of the Cape, but much lower than we were when we did this 2 weeks ago. Like I said, we're down 3-ish, a little over 3. So positivity, same thing. Everybody's sort of clumped in that same 5 to 6, 7% range. So again, those numbers are on a downward trend. MWRA, this just measures the amount of viral RNA. So this measures COVID in wastewater. And you can see that the far right, you have it on the lower and actually as low as it was last summer for as amount of COVID that is in the wastewater. To give you perspective, the far left was way off the chart. That was the original Omicron problem that we had January of last year, 2022. January of this year, you see it go up a little bit, but in relation to the original Omicron, nothing even close. And so our wastewater's down, cases are down, the state number of cases are down. We've been averaging, like I said, a lower number than we had previously. So all those are all good trends, and that's kind of where we're at. Boosters are still easily available, over 5. Anybody with young children, especially under 3, really should go to their primary care physician, talk to them first, their pediatrician. As far as where to get vaccines, it's still vaxfinder.mass.gov. There's still testing around. Home kits are what most people have. We just gave a bunch to the service center. Senior center's got plenty. Library's got some. We got some here at Town Hall. If you want a home kit, we've got some. While they last, the state gives them if we order them. Don't know how long that program will last, so at some point we may not have them. But we have them right now, and that's what matters. So grab some. And I believe the use-by date is like November on that, so you'd have a pretty good time. So you can get home kits that way. You can still go through testing the old-fashioned way if you like. Some people want the accuracy of a PCR, and some people still do. Most PCRs are used in healthcare settings, and whether it's long-term care or if you're going in for a procedure at a hospital or an office or an outpatient type thing, they do PCRs. That's where we pick up most of the PCRs, I think. But yeah, you can still easily get tested. You got plenty of home kits, and VaxFinder has plenty of openings. We only had 82 in 2 weeks. 82 shots show up on the state list here. most of them being second boosters, 48 of the 82, and a little bit more first boosters, a few of those, and so forth. So, I mean, there's plenty out there if that's all we're giving. So, if you want to have a booster, second booster, or whatever, again, after 2 months you can get a booster. If it's been, let me go back up. You can get a bivalent booster. It's been at least 2 months since the last COVID vaccine. So you can. I wouldn't I don't know, you talk to your physician if you want to keep getting tons of them, but you can. If it's been a while, I think if it's been at least a half a year or so, you can. I think eventually you'll start seeing recommendations to do it when you do your flu shot every year in the fall. You start doing it on an annual basis. But so that's it for that. So what is out there is XBB is pretty much all of it. It's solidly had all of February to itself, pretty much, being the main. If you got COVID over the past winter, the whole winter, it's been most likely XBB for most of the winter. So you see, it took over more than 50% back on the 7th of January, and now we're into mid-March, and it's 99% of it. So if you get COVID, it's the XBB. If you care which variant you got, they're all Omicron-based. So as a recap, sorry to be quick, but it's pretty similar to last time. The county is at low, based on the CDC. There's plenty of vaccine, testing capability. We have test kits around town, like I said. The boosters now are bivalent. If you haven't had one in a long time, then maybe time to consider one. XBB is by far the dominant strain. There are no new regulations coming down, restrictions or anything like that. Nothing's being planned at this point in time. And so that's all I have for an update for this, and we'll do it again in a couple weeks. Thanks.